What are those?
That's eczema.
What's that?
There are 3 layers of skin. The top layer is the epidermis, the middle layer is the dermis, and the bottom layer is the subcutaneous layer, also known as the hypodermis.
Eczema symptoms include itching, red, and dry skin caused by inflammation. It's most commonly found in children, although adults can get it. Eczema is found on the top layer of your skin, also known as the epidermis.
Did you know there are many types of dermatitis? Atopic dermatitis, contact dermatitis, hydric dermatitis, and numular dermatitis, seborrheic dermatitis, and status dermatitis. Atopic dermatitis usually begins during infancy or childhood, but it can strike people at any age. It mainly affects hands, feet, face, inner elbows, or the back of the knees. Irritants that can make the symptoms of atopic dermatitis worse are rough clothing, soap, and household chemicals, and scratching.
Treatments for atopic dermatitis include products to lubricate and moisturize the skin, steroids, creams, and ointments, drugs that control the immune system, antibiotics to treat infections, ultraviolet light, along with a drug called porcelain. Contact dermatitis. There are 2 types of contact dermatitis: irritant contact dermatitis and allergic contact dermatitis. These types of eczemas can develop after a substance damages the skin. These include chemicals and frequent hand washing. Irritant contact dermatitis can develop after touching a strong irritant one at a time or by coming into contact with the irritant substance repeatedly.
Contact dermatitis can also develop after a person touches an allergy-triggering substance such as nickel, cosmetics, or poison ivy.
Dyshydric dermatitis treatments include cool, wet, compressed steroid drugs that are rubbed into a skin or taken by mouth. Porcelain combined with ultraviolet aid therapy. Numular dermatitis. This type of eczema more often affects men and women. Men usually don't get this first outbreak before their mid-50s. Women tend to get it in their teen years or early adulthood. Numular dermatitis causes coin-shaped red marks. These marks appear more often on the legs, back of the hands, forearms, lower back, or hips. The causes of numular dermatitis is unknown.
Treatments for numular dermatitis include protecting your skin from scratches and other injuries, taking a lukewarm bath or shower, then applying moisturizer to your skin, applying a steroid ointment to the rash, taking a steroid medication by mouth or injection that goes to work throughout your body, taking antibiotics if an infection develops.
Neurodermatitis. This type of eczema often affects these areas: sides or back of the neck, genitals, scalp, wrist, ankles, or inside and behind the ear.
Usually neurodermatitis causes a skin outbreak that doesn't get any bigger, but the irritated skin can grow thick and deeply wrinkled. The main treatment for this type of eczema is to stop scratching it. When neurodermatitis affects the scalp, it can be harder to treat. In this case, it may require the steroid medication prednisone, which is taken by mouth.
Seborrheic dermatitis. This type of eczema is better known as dandruff. An irritant is affecting the scalps in adults. It also often affects these areas: the eyebrows, sides of the nose, behind the ears, the groin, and the center of the chest. Seborrheic dermatitis causes skin to fall off into flakes. This condition may be due to an overgrowth of a type of yeast that normally lives in these areas, as well as an overgrowth of rapid shedding of cells on the scalp. It may be especially hard to treat in people whose immune systems aren't working properly, including people with AIDS. Treatments include shampoo containing salicylic acid, psyllium sulfide, or coral tar, antifungal treatments or steroids, lotions that are rubbed into affected areas, and steroid lotion.
Status dermatitis. This type of eczema can develop in people when the veins in the lower legs don't properly return blood to the heart. Status dermatitis can arise quickly, causing weeping and crushing of the skin. Over time, this type of eczema can cause the skin to develop brown strands. Treatments include steroid creams or ointments, creams or lotions that lubricate the skin, moist compresses, antibiotics to treat infections, elevating the legs. So this is ointment cream for eczema. It's called Charmacino. It's a big word. This is my eczema, and what I'm going to do is I'm going to use this over a span of 3 weeks and see if this gets any better. So let's see how this goes. I'll show you all the results in 3 weeks. So it's been 3 weeks I've been using this cream, and it looks like my eczema has cleared up completely. Like, it's almost completely gone. There's a little bit right here, but it's gone. So use the ointment cream. Your doctor can prescribe it. Cool. And there's Aveeno, there's Eucerin, and I don't know the other names.
Hydrocortisone.
And hydrocortisone. You can get eczema as a child or as an adult, but it is able to be cured. Also, the skin is the largest organ in your body, and its functions are to protect, to regulate, and to sensation. I don't know what the last one means, but it's sensation. Eczema. Hi. Contact dermatitis can also delete that one.
Go.
Did you know that there are many types of eczema, such as atopic dermatitis?
Just keep going.
Okay, contact dermatitis. Wait, let's start over. Delete that. Usually I'm sorry, I'm a derp.
It's okay, go.
Okay. You should stop that video. Okay. Usually neurodermatitis causes dermatitis, pneumolar dermatitis.
And go.
Usually neurodermatitis can cause
Be stupid. I am.
Run around. Okay, run around the tree. Run around the tree. Okay, 2 times. Go. Yeah. Keep going.
Go. We look real stupid.
Okay.